Of 29, sunny in Johannesburg at 15, highs of 25, cloudy in Kinshasa at 25, highs of 30, mostly cloudy in Lagos at 26, highs of 32, sunny in Mogadishu at 28, highs of 31, Addis Ababa cloudy at 15, highs of 19, Dar es Salaam cloudy at 25, highs of 30, 9 and cloudy in Paris, highs of 12, cloudy in London at 12, highs of 14, New York is partly cloudy at 22, highs of 26, and Beijing in China sunny at 19, highs of 20.
Mature, intelligent talk every morning. Spice up yourself. Mornings done right. 94.4 Spice FM, Nairobi.
Continue our conversation with Ashley Muteti, founder, executive director of the Zuri Nzilani Foundation. So, your own experience led you to start a foundation.
Mm-hmm.
Is at this point, had you interacted with other women who had gone through the same preeclampsia, premature birth, low birth weight as you?
So during my hospital stay with Zuri, I realized majority of the women who had babies in NICU were
What's
there.
NICU?
NICU is in neonatal intensive care unit. So it's an ICU for small babies. And when we were there, I realized majority of the women are admitted with their babies there because they gave birth prematurely as a result of hypertension. And none of us knew what this thing is. We've never had it before. Some had babies and they had delivered safely, but now had this other baby and it was complicated. This was the first time pregnancy, same to me. So I said that there's a problem.
And even throughout your pregnancy journey up to this point, you had never heard of preeclampsia?
I've never had. But after I had it, my mom told me she also had it with me. Because I was also born 2 kgs and I was born 8 months. So I was like, what?
Allah.
Yeah. Yeah. So after my own experience, my mom told me she also experienced something similar with me. And I said, if all of us don't know about this, majority of us have babies here because of this thing, then this should be a very serious issue. And we went, I was in a good hospital and I wondered, okay, I'm receiving really good care. What about that woman who cannot afford this? How is she handling this? My bill was 6.9 million.
Wow.
I didn't even know where to start. Like, we didn't know where to start.
Yeah.
Like, he earlier asked about Mzee. But we didn't know where to start with a bill of 6.9 million. This is a very young couple. And this just goes to show how expensive it is to have a child in NICU, in ICU, and how expensive it is to have a premature baby. So my own experience led me to really start this foundation and be the voice for women, create awareness. And we've seen what awareness can do because you have a social support group of women who have given birth prematurely, who have lost children and have also had an experience with preeclampsia. And between 2023 and this month, we've had 43 successful births because of education. Because
of people that you have reached out to.
Yes.
As Zuri Nzilani Foundation.
Yes. And they've learned if I'm feeling bad, I'm swelling, that is not normal, I need to go to hospital. If my blood pressure is 150 over 100, I cannot stay at home. You see, one of the things I hear doctors say is that, women come in very late when really there's nothing we can do as medics, but, try to save your life. But if it is something that can be detected early, it can be managed and you can be able to save the life of the mom and the baby. And maybe if you cannot save the life of the baby, then you can save the life of the mom, which is still unfortunate. Yeah. So this has been my main reason why, Zuri Nzilani exists, to create awareness, to advocate for these things,
So how do you do that? How do you create awareness?
through social media, through outreach. We do community outreach. We also do community radio, and have talks there. At times send medics to have tough conversations that I cannot have because I'm not a medic, and also like having sessions with women, like educative sessions. And at times we have those sessions, and we've partnered with a hospital called Jacaranda Maternity, that when we have these sessions, they come in with the medical expertise and offer some of the services that are quite expensive, such as ultrasound scans for free. In a slum, the ultrasound scan is around 1,500 or 1,300. So will this woman buy food for her family, or she will go and do
the ultrasound?
The ultrasound, yeah. So that's how, we reach out to women and families.
When you say this, then you say that there's a lot of, there's lack of awareness.
Yes.
Widespread lack of awareness. But then there are very many women who are pregnant as we speak today. They are expecting a child. There are very many of them who turn up to health facilities for just those regular visits. How then are we saying that there's lack of awareness? There are many women who have given birth and gone back home. Maybe they had preeclampsia, maybe they didn't, they went through it, but they had interaction with medics throughout their pregnancy journey.
Yeah.
And they have sisters, they have cousins, they have daughters, and they still don't have awareness. That tells you that the medics don't actually pass the information.
And at times, that's why we do some of these intensive education platforms, because when you go for antenatal checkups, there are like 50 women lined up.
Yeah.
By the time I start educating one person about these are the dangers, these are what, and there are 50 people lined up, there's really not much time to do that. Yes, we'll give. I've been there when some of these clinics happen, and they'll tell you, if you have a headache, if you have this, if you have that, you come and see. But you don't know the intensity. Okay, I'm having a headache, but how bad? Yeah. If it's high blood pressure, how bad? If it's at what point should I come to the hospital? So at times this information is not passed, I agree, during these antenatal clinics. And that's why even this month, we're really focused on this digital campaign called Tiny Hearts, Big Futures, to really raise our voice about prematurity, what causes it, and how women can be able to get assistance.
Would it help, say, for instance, whenever people are in a waiting room, since we're talking about expectant mothers, usually a TV, and with that TV, you're watching whatever is on TV, would it help if that screen, instead of telling you about the accident that occurred in Mahiu and whatever happened where?
Kindiki swearing in.
Kindiki swearing in. Seriously, or
and Diwali,
or telling you how there's this backflow in Nyando and people have been marooned for almost a year, that you actually had medical education being channeled through it. Would it help?
It would. And even when there are 50 women over there, a nurse can come and talk before they go in to get checked. At least have that, conversation, because all of them are seated in one place.
And they wait.
Yeah.
And others also come in. So it's a message that could be repeated.
Yeah.
So if you're there for a while, you'll have heard it enough times for it to have saturated it.
Yeah, but a TV would actually be very helpful, and people, watch
because
it.
People watch TV.
Yeah.
And if you're sitting waiting, it's something for you to do.
Since around November last year, there are people now in communities called community health promoters, right? And they've been kitted. To the best of your knowledge, are they now doing a better job of creating awareness? Because one of the things that they do is they visit you in your home. So obviously, the people, expected mothers, are a touch point. Are they helping? Do they know about preeclampsia?
Now, yeah, that's actually a really good point, because as a foundation, we are actually heading in that direction of building capacity for
CHPs.
For CHPs. And it's important because they talk about a myriad of issues, malaria and everything. But what about the top leading causes of deaths for moms and for babies? How can a mom be able to identify, I am in danger? And, so I agree. even with nurses and probably midwives in the rural settings that we have, there still needs a lot of, capacity building and training.
You touch on something which is vital there, rural areas. Some of these health facilities in rural areas may not necessarily have a TV, but they would have a health promoter. There's something in medicine they call continuous medical education. It's usually meant for people who are health practitioners, but there's nothing stopping them, again, from what you mentioned, from somebody who works within the facility to actually periodically come and you time yourself. This is the message you're going to give. And you talk to this group, because sometimes those waiting rooms are full.
Yeah.
And there are people, and they're going to be there for some time. So in essence, they're a captive audience.
And it's a common thing, like you've said, between, was it November to now? Or
Last year.
Last year to now.
Yeah.
The number of women that you've come up, in contact with as the Zurin Zilani Foundation, and you've created awareness for, and you've helped, that have then ended up having proper deliveries. How many?
43.
Despite having preeclampsia.
Yes.
So 43 women actually got high blood pressure during pregnancy. There are very many more than
Yes.
that you didn't know about, right? Are there cases where you have had to support, let's say, a woman at a point of need to access emergency medical care?
Yes.
How so? Give us a case.
Last year, there's a lady in Kitale who was pregnant. She had severe hypertension, and she went to a facility near her. Her blood pressure, when she checked, it was around 170/110. And the facility told her to go back home because they can't handle her.
Huh?
Yes. The facility told her they can't handle her. She goes back home. They gave her medication and told her, go back home. In an ideal situation, you will not leave that hospital. That is an emergency case. Yeah? And she wrote in the group, ladies, this is my BP. I've been told to go back home. At that time, there are people in Eldoret, in Kitale, and everything. They facilitated. It was around 7, around there. PM. By the next day, 9 a.m., people had already facilitated her to go to a hospital. She delivered that morning. That next morning, she delivered. So we were like, if you're being told to go back home, we don't know what to do. That's why people sleep and they don't wake up, or, some of the things happen, or you start bleeding. How will you get assistance?
What level of health facility was this that couldn't handle it?
It
was a private clinic. Was it a public clinic?
It was not. It was like a private.
Did it offer
small
maternal,
clinic?
Yes,
they do offer. That is where she's been going for her antenatal clinics and everything. And that's why we are even saying we need to train, or we are advocating even at the smallest facility, the primary health care. There needs to be even one basi incubator where women are delivering. Then even one. I've been to a facility where has 300 bats in Kariobangi. 300 bats per month.
300 a month?
Yes, 300 a month. And there is one incubator and it's not even functional. So the chances of a woman coming there and giving birth prematurely, you will lose your child.
High.
It's definite. You will lose your child because there is no first aid. How can we be able
this
to
is a
give
Ministry of Health facility?
Yes, it is.
Some research done by a consortium of researchers, the Aga Khan University Hospital, Tampere University in Finland, and others, on this, they found that it's actually a global phenomenon.
Yes, it
One
is.
in 5 children globally is likely to be born preterm, low birth rates, right?
Yeah.
1 in 5 globally. And most of them are in these parts of the world.
Sure.
In Africa, in Asia, and South America. And so it just points to health systems that are just not equipped to deal with this. But it takes you back into policy.
Yeah.
With all the expertise that we have in medicine, with clear indicators, and I mean showing that our children are dying below the age of 5, and there are very many things that are telling us how they end up dying below the age of 5, how then are we not
that
pinpoint this and say, let's plug this gap?
It makes me sad because we fully plan for natural catastrophes, when the Mpox thing came, like there was proper funding.
Yeah.
By the end of this show, or by the time I leave this place, 2 children would have already been would die
in this country.
2 babies. Why is it not a national importance? Why is it not a priority? Yet we know this is a life and death thing. If by the end of today, there are women who are going to die as a result of probably preventable maternal conditions. There are babies definitely who will die. And it's sad that we are not prioritizing such a thing as this. It makes me quite sad, actually.
No, it's a very sad situation.
Yeah.
What you'll find, and what is strange, is when you look at the budget of the Ministry of Health, and we talk about free maternal health care, it's free because the government is subsidizing it. And the amounts that you'll hear being used to subsidize it are enormous. So when we hear that the services that are supposed to be provided by these monies doesn't exist, then the eternal question we ask in this studio is, okay, so where does the money go to? Because clearly, a place like Kariobangi, with the population density that they have there, this is a facility that should have several incubators, not one. Several.
Actually, Karioko. I would say
Karioko.
Yeah, it should have several, and you anticipate that's the thing. We ensure, and I wish even our politicians and governors can stand up and say, in my county, no woman will die. No woman will die giving birth, and I will make sure even if they give birth prematurely, they have a fighting chance of surviving and thriving. We have to even have that political goodwill and say, okay, we'll channel our resources to ensure our facilities are equipped. I mean, there's a woman who gave birth, I think, to 5 babies, and her babies died because the hospital did not have the capacity to care for those babies. It's unfortunate. It shouldn't happen.
So in your interaction with, I'm sure you've interacted from top policy level with the ministry, with medics, with doctors, with nurses, all the way to community health promoters, all the way to even midwives, right?
Yeah.
Is the information gap spread across?
It's a challenge. And even
so even midwives do not know what to look out for. So they know, do pressure, but do they know what to do in case you find?
So there are definitely strategies that have been laid out, and at times even policy. I was having a look at the Linda Mama program audit, and the biggest challenge was execution. Yes, it was functional and everything, but the biggest challenge was implementation. And you find that things are made at top level, but the information gap and communication gap is so huge that people in the county level now don't have like a roadmap to use and say, okay, when a woman comes, what's the protocol to check, check for this, a baby has died, let's record at what point did we weigh this baby, did we do this? So there are things that are still like huge gaps, in terms of information.
Poverty is also a contributor, isn't it?
Yes.
Because you mentioned something to do with diet. Explain.
Yeah, so malnutrition, when you're pregnant, you also take these supplements. At times, there are women who don't and can't afford.
They just can't afford the supplements.
Yeah, they can't afford the supplements. So what happens to them? It poses a risk. So the baby, the baby is not even growing, and you'll give birth to a very small baby, or you'll give birth early. Yes.
There's a lot that you've done at Zurinzilani, so you're creating a lot of awareness, like you've said. You are, championing all these things. Is there anything, in terms of collaboration that you do? collaborating with research organizations, collaborating with other like-minded organizations, because you know that there's there's an information gap. We have 1 million children born every year in this country. Now, those are 1 million pregnancies at risk every year. That's a lot of information that's needed.
Over 100,000 of those babies are premature.
And Eric, in case you thought it was safe to get out of the water, the budget for maternal health in this country was 4 billion. It was reduced to 2 billion.
It was reduced.
It was reduced, just so that you understand. Though, of course, we increased the budget for women empowerment. But the point being, you pause and wonder and ask, okay, we know that more children are being born. That million is increasing, it's not going down. So why is the budget for this particular service that caters for these children who are about to be born, why are you reducing it, and yet more people will need this particular assistance? What's the rationale for reducing it?
Yeah.
It's because Margaret is no longer the first lady.
Oh, that's a punch.
Someone has actually mentioned here. Remember the First Lady's program when Margaret was First Lady? What was it called?
Beyond Zero.
The Beyond Zero, right?
Yeah.
It was basically advocating for this.
Yeah.
I know that even First Lady Rachel has a program that is dealing with, advocating and pushing on issues of maternal health. Okay? But then you ask yourself, so why is it that this thing is relegated to, the office of the First Lady? Those things where enda saidia wa mama, mfanya mambo, uonekane unafanya kazi.
Saidia mama kama wewe.
Uonekane unafanya kazi. Is that the attitude? That comes out like that. It's the attitude of government.
It appears so. In fact, you're almost limiting the capacity of that and the roles of the First Lady to just that. You see? Okay, let's say you've decided that is what it's going to be. What is the national priority when it comes to maternal health? Because everyone, even those who are in position of authority, it's maternal health that ensures that you become a human being in the first place.
That's true.
Yes, that's why you're sitting there doing whatever it is you're doing.
Yeah.
So that chance that was given to you, why is it not being given to others?
True.
Ashley, you're running this campaign, Tiny Hearts. So if anybody would like to get in touch with the Zuri Nzilani Foundation, how do they do that? How do they support you?
Okay.
In a minute.
All right. So we have, we are running Mchanga, to assist women who are currently in NICU and have huge hospital bills, and also to assist with their psychosocial support, like therapy. So we are running an Mchanga campaign, and you can be able to see that in our socials. You can follow us on Zuri Nzilani Foundation on Instagram and Facebook. And if you want to get in touch, please also you can DM us. We're very open to collaborations because the goal is one, to ensure that moms will not die and children, even if they're born whatever way, that they have a fighting chance of survival.
So Zuri Nzilani Foundation on your social media.
Yes,
on Instagram, on Facebook.
Yes.
On X. Zuri is Zuri.
Yes.
Nzilani Nzilani.
Yes.
So see Nzuri. It is Zuri.
Zuri.
I read my remote. It is Zuri.
Yes.
Zuri.